Okay, just gone 12, so let's make a start. Welcome everybody. We've got a really nice turnout today, and I think there'll probably be still some people joining us as we make a start today. But we're here for the Working Together to Safeguard Children 2023 learning event. So I'll just make a start by doing a little bit of housekeeping before we get going. Just bear with 1 second. Okay, so most of you have got your cameras off. That's really helpful. We will be recording the session as well, but Hayden usually works his technology magic and cuts any heads off or anything like that, which is great. If I can ask you to make sure that your microphone is muted, it really just helps with background noise. And obviously presenters, when you come on, just be mindful of popping your microphone back on. Otherwise we'll have the typical you're on mute scenario that we tend to have in most of our meetings. We've given ourselves lots of time for questions and answers at the end. So please do share any questions as we're going through the presentations into the chat, and we will collate those at the end. There are no silly questions, is what I'd say. If you're not sure about something, please ask, because I can almost guarantee if you're not sure about it, there will be someone else in the room that's not sure about it as well. So pop them in the chat. Or, as I said, we will have a bit of an open forum at the end, so you can kind of pop your hand up and ask any questions verbally as well. In terms of accessing the presentation, like I've said, we will record this one, and this, as well as our other learning sessions, are available on our YouTube channel. So that's easy to find. Just go on YouTube and search for us at NYSCP. You can like and subscribe, and then you'll get a notification of when this one pops up, which will probably be next week by the time we get the editing done. We will ask you to complete a post-course questionnaire that'll come through via NYS, which is who you booked to attend with, and then you'll get a certificate of attendance as well. So, as I've said, we're here today to talk about working together to safeguard children. This is a document that we all need to have that awareness and understanding of. And this session, it's a bit of a brilliant session, really, because we've got the privilege of having wider partners coming to talk to us about what it means for them and their practice. So we've got quite a lot to cover in the agenda today. Most of you who know our learning sessions as a business unit, we give ourselves an hour, and you have that hour over your lunch break to kind of pick up on some of those safeguarding updates from us. We've given ourselves 2 hours today just because we didn't want it to feel rushed, and we wanted to have that opportunity for partners to ask questions at the end. We may not take the full 2 hours, but we will make sure that we are done before 2 hours so you can get on with your day at 2 o'clock. Just to go through the agenda, I'm going to make a start by just giving a very brief overview of the document, and there are lots of information already available. I'm sure some of you may have accessed that, so I won't dwell on that too long. And then we're going to head over to our partners, who are each going to have a slot talking about what working together is and kind of what it means to them and their practice. Just before we make a start, if I can ask our presenters to just turn your cameras on and just say hello and introduce yourself, please, if that's okay. David, you're up first. You're the first one that's popped your camera on. Do you want to introduce yourself?
Yeah, good afternoon, everybody. I'm David Sharp. I'm Chief Executive of North Yorkshire Youth, and as you can see from that agenda, I'm near the end. So hopefully you all manage to stay and watch me talk about what the voluntary sector's got to offer in terms of this agenda.
Thanks, David. Have we got Sarah, have we got you on the call?
Hi, yes, I'm Sarah Stansmore. I'm the designated nurse for safeguarding in children working for Humber and North Yorkshire ICB. And I'm just going to give an overview really of any health changes and the health-led initiatives that have been ongoing over the partnership health-led initiatives that have been ongoing over the last year.
Thank you. Emma, are you with us?
Yeah, Emma Bedford, Detective Inspector for the Safeguarding Vulnerability Assessment Team for North Yorkshire Police.
Thanks, Emma. Sam, are you here?
Yeah, morning everybody. My name's Sam Clayton. I'm the Head of Effective Practice and QA in Children and Family Services.
Thanks, Sam. And Julie, are you here? Are you with us?
Yes, I'm here. So I'm Julie Bunn. I'm the Interim Head of Alternative Provision, Sitting in Inclusion, but I'm remaining the substantive virtual school head. And I've still got my fostering background, because we always want to talk about fostering, don't we? If anyone's interested in becoming a foster carer, let us know.
Thanks, Julie. And then finally, Hannah, if you can just introduce yourself because you're going to be presenting with me.
Hi, afternoon everyone. My name's Hannah Ellingworth and I'm the manager of the Safeguarding Children's Partnership for North Yorkshire.
And this is where I breathe a huge sigh of relief that everybody's here and made it into the right meeting. So massive tick, we've made a great start. Thank you, everybody. So I'm going to start by just giving us a really quick overview of working together. So hopefully you all know we were gifted with a lovely Christmas present in December 2023 with our new iteration of working together. This replaced the previous 2018 version of the document. Now, the DfE have advised us that there will be annual updates to this document from this version onwards. I was kind of fully expecting some kind of email or update to land in my inbox at some point before this session where I would be rapidly panicking and getting some update slides, but we haven't had any updates yet. We're not foreseeing any significant changes, certainly none that would kind of warrant the work that's been done over the last 12 months with this document. But please do be rest assured that when we do get any updates, we will share those with you. We'll put a briefing together and we'll put that onto the website. So the working together document should be read in line with the government Stable Homes Built on Love strategy, and there were other updated documents of note, which were the Children's Social Care National Framework, which I'll touch on a little bit later, and guidance on improving practice with children, young people and families. So this provides advice for local areas on embedding the working together guidance and the Social Care National Framework in practice, which is what we've been looking at as a working group, really. So working together when it came out in 2023 was split into chapters. There are some new chapters which I'm going to get to, and like I say, we are going to just touch on these chapters very briefly. We do have a short recording that you can kind of share with your teams, which goes over it in a little bit more detail. It's only about 10-12 minutes long. And we've got that on our YouTube channel. I've had about 250, 300 people view that so far. So it's kind of doing the rounds. But if you want something really quick to kind of share with your team to actually go through working together in quite a lot more detail, we've got that resource available for you as well. So looking at chapter 1, so while the kind of structure of the legislation in working together remained broadly similar, there were some key updates, and the first of which was this new chapter based around a shared responsibility. So this strengthens the theme of partnership working and sets out expectations for all practitioners involved in the safeguarding and wellbeing of children and young people. And it's really one of the focuses of why we're here and what we're doing today. It's about hearing what working together means for partners working right across children and with children and families right across North Yorkshire. So there are expectations in this chapter for all practitioners, aiming to ensure that we all share the same goals, we learn from each other, we have what we need to help families, and acknowledge and appreciate a difference and have that understanding of the different perspectives that we can all bring that gives us a much deeper and richer understanding of what's happening for the lives of children and families. And this is structured across all levels. So what I kind of want to reiterate is this isn't necessarily just a strategic document. It's not just an operational document. It's for everyone who's working with children and young people and families, right through to kind of volunteers and frontline practice. It's about us all having that awareness of what this means. The chapter also highlights the 4 principles that all practitioners should follow when working with parents and carers. And that's primarily around kind of working respectfully, involving parents in planning, empowering and working in partnership working, and using respectful, non-blaming language. There's a lot of stuff around kind of effective information sharing, and as a result of the working together changes, we have done a full review of our information sharing guidance, and that's a 1-minute guide, which again you can share with your teams. I think it's a useful one to just have some ongoing discussions about. Can I just check that everyone's on mute, please, because we've just got a little bit of background noise. So chapter 2 of the document really kind of focuses on the multi-agency safeguarding arrangements, and all safeguarding partnerships were asked as a result of this new working together document to review their safeguarding arrangements, and these arrangements kind of set out ultimately how we should all work together to safeguard and promote the welfare of children in North Yorkshire, and how as a partnership we value every voice. Ultimately, it covers how we work with all of our partners, and that includes children and young people and parents and carers. We very much see them as safeguarding partners as well. Alongside this, the arrangements cover who our lead safeguarding partners are. So these are our kind of lead partners who each have an equal and joint responsibility for safeguarding arrangements, and the leaders of their organisations and statutory safeguarding partners. I'm going to get onto this a little bit later, right at the end, when we kind of touch on our multi-agency safeguarding arrangement document. It also covers who our delegated safeguarding partners are. So these are appointed by the lead safeguarding partners to act as representations across the partnership. It states the role of the executive chair and the independent scrutineer. Covers things about our funding arrangements and the structure of the partnership, so how all of our meetings and groups and subgroups fit together and their lines of accountability. And it covers how we work with our relevant agencies. Effectively everyone, but of note, working together stresses the importance of education and our voluntary sector partners. So we've already done a lot of work to kind of strengthen that partnership working, but we've made sure that we have representation invited here today, so they can share it from their point of view about what it means. And then finally, it shares how we capture and share good practice, and also how we share learning, which is so vital as we strive to ensure we develop the best practice for helping families in North Yorkshire. Chapter 3 looks at providing help, support and protection, and considers the functions of early help services, our section 17 or child in need, and child protection. So firstly, looking at early help, the chapter talks about the consideration of the needs of different family members in the network and how they impact each other. It includes considerations of specific needs. So, for example, parents with disabilities, parents who identify as LGBTQ, families where English isn't necessarily their first language. And it also focuses on the importance of building on family strength and providing an enabling approach to that decision making within a family. It stresses the need for closer working with education and childcare, which I know Julie will talk about later on. And it's just worth noting, we do have an early help strategy in North Yorkshire, but we are in the process of reviewing that. And the theme of that will very much be this idea of early help being a multi-agency system of support, not just a service provided by one particular agency. The chapter clarifies that there can be a broad range of professionals who can act as a lead professional in child in need cases, and that consideration should be given to who the family feel is the best place to take that role and support and work alongside a family. It builds on what we talked about in early help, about the importance of assessments capturing and considering the parenting capacity of resident and non-resident parents, as well as that consideration of those in the child's wider network. So who else is in that child's life, not just the parents living in the family home. And the chapter also introduces these new multi-agency practice standards for all practitioners working or volunteering in services and settings that come into contact with children. As a partnership group, we will be looking at how we can make these standards more visible and understandable across partners. And we're really conscious this is just not just something that needs to be known by children's social care. And I know Sam will probably touch on that a little bit later on. It's also notable that it stresses the importance of children experiencing harm outside the home. And when I talk about harm outside the home, also having that consideration of the online world being a contextual space where young people are spending time outside the home, and the risks that they can be subjected to in that space as well. Chapter 4 of Working Together there wasn't any significant changes to chapter 4 really, and it sets out the responsibilities of individual agencies and organisations. This is captured from a partnership point of view by an audit that we have to complete, as mentioned in section 11 of the Children's Act. Now, these audits take place every 2 years, and as a partnership we analyse the single agency responses and identify any thematic areas of strength or areas of practice development. We are in the process of reviewing the audit tool, so that will take into account any of those changes that have come in from the new Working Together document, and partners will be expected to complete that in 2025. So from a frontline practitioner point of view, that the work, you don't have to fill in the audit. That's normally done by senior leaders. But I think it's really interesting to kind of have an awareness of what some of that audit has found in terms of practice. So I have popped a link in, and I think Hayden will pop it in the chat. These are the findings from our last audit report, and I think it'd be useful to have a look at that as well. Hannah, over to you for chapter 5 and 6.
Thank you, Kat. So in terms of this chapter and with regard to the Safeguarding Practice Review Group, there's been some changes, particularly when we think about deaths of care leavers. So just as a bit of an overview, what we call a SPRIG, so the Safeguarding Practice Review Group, looks at incidents of where a child has suffered serious injury or death as a result of abuse or neglect. The purpose of the group is to understand not only what's happened, but also why it's happened, with a view to considering how frontline practitioners might want to respond in the future. So that's about understanding, learning from a specific case. So the Safeguarding Practice Review Group is a partnership group, and as I said, it's to try and draw out learning from what we recognise as being really tragic events. So on our website, we've got a 1-minute guide about the Safeguarding Practice Review Group and what we call rapid reviews. Similarly, when a child dies, the partnership also have a responsibility to understand if there's any points of learning that happen around that child's death. Again, there's information on our website that should be easily accessible. And then with regard to the changes in working together, so from December 23, the working together places a duty on local authorities to notify the Secretary of State for Education and Ofsted if there is a death of a care leaver up to the age of 25. So the notification happens regardless of whether abuse or neglect has been present. However, the local authority will then make a decision about whether a rapid review is required to consider the circumstances if it is felt that abuse or neglect have been present. We're conscious at the moment that while we've developed a process for that, the operational ways in which that's going to work still need some thinking through. So we're really interested to hear from partners around how they think we can really understand how we're going to become aware of care leavers who have died. So it's a sort of watch this space really in terms of the operational discussions and guidance. Once that's all been agreed, we'll make sure that it's really clear on our website. Thank you, Kat.
Thanks, Hannah. So, like I say, that is a very whistle-stop tour of the chapters of working together, some of the more significant changes. And I think as the session goes on, you'll probably hear in a little bit more insight what some of those chapters have meant for our wider partners. But I just kind of wanted to finish my bit on kind of looking at what we've been doing as an operational group over the last sort of 8-9 months, really. So when the document was released in December 2023, because there was such significant changes, as a partnership, we decided we wanted to look through this and work through it together, to give ourselves kind of the best chances of implementing these changes with a common understanding and a common language, really. So operationally, we've been meeting every month with attendance right across the partnership. So think about all of our statutory partners as well as all of our relevant agencies. We've had representation through education, through our voluntary sector, through probation, through health services. So such a wide variety of partners have been coming to these meetings. And it was about kind of ensuring the changes were implemented. So we knew these changes meant changes for our individual partner agencies. It might have been changes to policy and practice guidance, training, things like that. And it was about kind of providing some of that assurance, but it was also kind of about providing support to each other. You know, we were going through this together, and we wanted to kind of make sure we were all offering that support for each other and guidance. And from a partnership and working together point of view, we wanted to make sure that these changes were as understandable and as accessible as possible, really, for everybody right across the workshop, the workforce. So we've been bringing people together. We've been trying to kind of come up with this shared and common language about how we promote these messages. We've completed a report, an assurance report, which went to our executive group in November to kind of highlight the work that we've been doing. And again, you'll hopefully have seen on the website, we've been doing some quite significant changes to all of our practice guidance and 1-minute guides. Some of them have just needed minor changes in terms of changes to references, but some of them we have had a complete refresh and review. As a business unit, we've worked through about 150, so it's been a bit of a labour of love. But yeah, so like I say, the ones that have had probably more significant reviews are information sharing, which I think Hayden's already shared, and practice guidance around professional curiosity and managing different professional perspectives as well. Hopefully you're all aware, but we kind of came up with the idea of having a centralised hub of information that's on our NYSCP webpage. We launched that really kind of in the summer, so it's only been going sort of 4 or 5 months, and we've been trying to keep that as an area where we will put the partner briefings and the recordings, any changes. We will put the recording of this session on that webpage as well. That's clearly getting out there. We've had well over 700 views on that webpage as well. And then finally, we wanted to put together this learning event. We wanted it to be an opportunity to hear from right across the partnership about what working together means to them, and to give you that insight into the ways our different partners work. So some of you may be joining us from education, some of you may be joining us from Children and Family Service. And I think it's quite insightful to kind of have that understanding of how our wider partners work, how they interpret working together, what it means from a health perspective, what it means from North Yorkshire Police. So we hope you'll find our presentation useful going ahead. And I'm going to hand over to our first panel member, which is Sam. So over to you, Sam. Just tell me when you want me to move the slides across.
Yeah, brilliant. Thank you. Hello, everybody. So a lot of what I'm going to say, obviously, Kat has already touched upon. So I'm not going to labour the point and read every slide, but I think these are going to be available afterwards for people to follow up. So working together and the changes, clearly, we've all been working on this for a number of months, and as such, working together has been in situ now for many years in one iteration or another. And so for people who are working in children, young people in general, you will all have an awareness of that. So if we can move through, Kat, please. So again, working together has always been about multi-agency working. However, this iteration is really strengthening and focusing the multi-agency whole system approach. As Kat's discussed, this links into some of the care review findings and some of the extra additional strategies around kinship networks, and more recently the Keeping Children Safe and Helping Families Thrive document, and work that has been as part of the reform agenda. So how does this fit for us? Next slide, please, Kat. So we have a defined practice model in North Yorkshire, which people will be aware of, and this is aligned very much to the care review and to the documentation that sits with working together and the changes and the whole strategy and policy that sits behind this on a national level. Thinking about child-centred approaches, considering the whole family, big emphasis on partnership, early intervention and prevention, and right person, right time, transparency and accountability, and the continuous learning and improvement and upskilling that is needed in order for us to respond to the very changeable environment in which our children and the families are living currently. Next slide, please, Kat. So, in terms of the impact on practice, again, it is a much refreshed focus, really, because we have always had a multi-agency partnership agenda and working on relationships, particularly the relationships we have with families and carers, and some principles that sit behind that. Again, this is emphasised in our strengthening relationships practice model and how we want to deliver all our services to children and their families, looking at tailored work and how you can work together with the multi-agency network around the child in order to improve their outcomes. Next one, Kat, please. There are some changes which Kat has alluded to around people who have lead roles in safeguarding, and that being again restated in this documentation. It's always existed, but no new accountabilities and increased and improved safeguarding work with education and third sector and voluntary organisations and partners. Clearly in North Yorkshire, those people have already been at the table and we continue to work with them. Again, it's giving greater clarity, enhanced accountability and engagement. It's also taking in the wide range of organisations who are in our communities and working with children and young people. Next slide, Kat, please. There is a renewed focus on help and protection for children and their families, and again, focusing on child in need and how we can manage those children who have child in need status, and looking at some multi-agency child protection standards across the board. Again, what this means is expanded roles for education, and Julie will talk about this with her duties with the virtual school in particular, I'm sure, and how we are engaging with the family network early and from the beginning of our involvement, and therefore we can make more robust child protection responses. There's an acknowledgement the environment has changed and that online harms are much more prevalent and a massive part of young people's lives, and in many ways we need to spec up for that because this is an emerging area of concern. Next slide, Kat, please. So again, just to refresh, this talks about some of the organisational responsibilities that people have, bringing in probation partners, and I'm sure people on the call will be aware that we now have probation sitting in the MAST screening team and looking at secure schools and homes and the places for children. There have been also, in addition to that, some background regulations around unregulated provision and all these sorts of things in order to try and improve the quality of the arrangements for young people. Next slide, Kat, please. Again, an emphasis on us learning from serious incidents and how that is reported, looking at thematics, so all the work that people are involved with around some of the QA works and the subgroups and the practice development, all highly relevant, with an aim to acknowledging that there would be improved outcomes for care leavers, but also recognising some of this is from decision making earlier in that care leaver's life when they are looked after, streamlining, so some administration aspects and how we then apply the learning into practice. Next slide, Kat, please. So the updates on child deaths and different emphasis really for coroner's role and how they share what the findings are from those inquests and things like that, and about how all the data can be triangulated in order to help us look at patterns and trends, predicts and respond to emerging themes with young people. So again, I won't labour the point on that, but this is all about improved outcomes for young people overall. Next slide, Kat, please. In addition to this, there have been some additional duties that have come online as well that have probably also contributed to the Working Together update. One's around serious violence and domestic abuse and people's responsibilities in addressing that, sitting behind some of that overarching strategy around ending violence against women and girls. And so this is about looking at everybody's responsibilities and providing support again to upskill everybody who are involved with children and young people in being able to respond and address effectively some of these issues as they are emerging. Next slide, Kat, please. So there's a renewed emphasis really on whole family assessments, again for people who are doing assessments, whether they're child and family assessments, assessments for the early help area. These are about thinking about the whole family, thinking about how that impacts on the young person and including every aspect of their life and how that is affected to enable them to achieve. So this is about looking at strengths, capabilities, and also building on family strength and capabilities, which links back to the overarching principle about improved relationships with family, collaborative working, in order to improve the outcomes for the children and young people overall when we're involved with them. Next slide, Kat, please. Again, the early help strategy was on that slide, and as Kat spoke about in the intro, that's been reviewed, but all that document interacts with all of these changes as well in working together. So, putting it into context. Next slide, Kat. There's a massive emphasis in the new working together on the effectiveness of all the collaboration and the multi-agency working. It restates things that have been into working together for many years around how all the safeguarding partners, including local authority, health, police, education and the voluntary sector, need to work together and collaboratively in improving the outcomes and lives for children and young people. Next slide, Kat. The guidance is very explicit about roles and responsibilities, and there is a strong push for accountability and transparency. Some of this again links into some of the other findings that lean across from the National Review Panel and some of the other work that is ongoing, which all safeguarding partners are feeding through their work into that. So this is about people being accountable for their work, accountable for safeguarding, and understanding their responsibilities clearly. Next slide, Kat, please. There is a very big emphasis in this working together about listening to young people and children and capturing their views in every aspect of the work we do with them, whether that's assessment, planning, or any intervention we're undertaking. And as people will reflect on from the previous slide, we use Mind of My Own in North Yorkshire as an integral part of how we can engage with children and young people and seek their views to help them contribute to whatever work we're doing with them. Also, people have child-friendly documentation, jargon-free, leaflets, a whole range of things. So this is just to re-emphasize about the importance of capturing children's views so we can factor that into how we work with the children and their families. Next slide, Kat, please. I think this is what's new, is the acknowledgement that things have changed very rapidly and that probably as professionals, a lot of us would be in lag with the knowledge the young people have around technical and digital and social media. And so there is an emphasis on understanding all the risks related to this. And certainly anybody who's been around will recall that the Safeguarding Partnership did do some work with the Marie Collins Foundation. And there's a range of tools and things available to help people talk about online safety with children and young people, recognising this is a growth area in terms of us needing to upskill our knowledge in order to be on the same page with the young people we're working with. Next slide, Kat. Again, this new iteration of working together re-emphasises the responsibilities we have to vulnerable groups, and is recognising children who have additional needs and disabilities, young carers, children in care, and young people exposed to domestic violence or mental health challenges. Again, linking it back to the wider work, we've had some of the findings from abuses in homes for children with disabilities, and we understand about how some of these childhood experiences can impact on young people as they grow up and become adults and grown-ups, and how we can do our work to minimise the impact of these. Next slide, Kat, please. Much simpler language. There's always a big emphasis on language, so people understand that. Certainly, people are trying to write more to children, write in language they understand, do words and pictures. People are engaged in a range of things that help make things, what is quite a complicated process, more understandable really for children and their families. And so this is just ongoing work really about unjargonising what is a very professional-led approach, and so there is acknowledgement, and certainly there's been a number of reports about that by the NSP and Bernardo's and a range of activities where young people have been consulted with, and we've done our own here in North Yorkshire, and certainly the feedback is, I think, from young in North Yorkshire that they want clear, understandable language. So we continue with that. That's a work in progress. Next one, Kat, please. Again, a real emphasis on reflective supervision for people who are undertaking safeguarding work and recognising how important that is. And the links again across into the work on professional curiosity and links into the wider work around having difficult conversations and how we do all that in our professional lives. So this is just re-emphasising how important supervision is for people undertaking safeguarding work in order for them to be able to discuss their worries, but also get additional support around the work they're doing, and also pose the so what questions, because what we know historically from some of the work that we've had from national panels and abuse inquiries is you always have to keep yourself open to the prospect that things can happen here, and therefore we respond to that in an appropriate and open way, and remain professionally curious. Next question. Next slide, Kat, sorry. So the new bit on care leavers, in particular care leaver deaths, which Kat spoke about in the intro. This is about us hopefully learning from that and then being able to put in additional support. For people who are in North Yorkshire, you'll know we've got that the Always There offer, where young people can come back to us through the care leaving service at any time during their lives, and do, even when they're in their 30s. This is a picture, these are real care leavers. This isn't one that we've made up. So again, it's about trying to support young people when they're adults, but also thinking about some of the circumstances that perhaps lead to those tragedies, and so we can consider our decision making when children are much younger. Next slide, Kat. Private fostering. Private fostering's always been part of the local authority's responsibility, and this is about people identifying these young people who are basically young people under 16 who are not living with birth family, and notifications. We've recently done some work on this, and in North Yorkshire we have 11 people young people who are privately fostered. We believe there's a lot more. So there will be an emphasis and a campaign on this in order to remind people what private fostering is. It's basically looking after somebody else's child where you don't have PR, and to think about how we can capture all the young people who are privately fostered in North Yorkshire. Next slide, Kat, please. Again, this is just to go back that underscoring a lot of what's in the new guidance is about remaining professionally curious and open to the prospect, and being effective in how you act on what young people tell you, really. There is some links into the national framework. The national framework overall is about multi-agency work being prioritised and being effective, recognising some of that old adage that, it takes the village to raise a child, and very much about the networks around the young people, that people who are leaders in organisations create the conditions for effective practice, but equally that the workforce is equipped and effective in discharging their safeguarding duties. So all of this ties into the outcomes for improving things for children and young people, so that they should be supported to remain in their family network when it's safe to do so. They should be safe inside and outside their home. And for children in care and care leavers, they should have stable, loving homes. So that's all I've got to say today. So, Kat.
Thank you very much, Sam. It's really insightful. Like I say, this is what we're going to be doing for the rest of the session, is to just look at what this means from different lenses. So Sam's just presented that through the lens of children and family service, children's social care, and I'm going to hand over to Emma from North Yorkshire Police, who is going to show us what it means from a North Yorkshire Police point of view. Over to you, Emma, please.
Good afternoon, everybody. I'm leaving my camera off because my connections are very, very poor. So if I'll cover what working together to safeguard children 2023 means for North Yorkshire Police. I think let's get forward. Can you hear me?
Yeah, we can hear you, Emma.
Thank you. So how do the changes impact North Yorkshire Police? So it's reinforced multi-agency collaboration with the emphasis on outcomes for children are best achieved through unified actions. For police, this has introduced clearer responsibilities and accountability measures within the safeguarding system. There's been a key shift, which in the form of the designation of lead safeguarding partners, so the LSP, from core agencies, which includes the police chiefs, and their role is to lead local safeguarding efforts. Before, it was very much focused on children's social care. Police forces are expected to work closely with other statutory partners and foster relationships within community groups, charities, and educational institutions to ensure a comprehensive approach. The guidance has also introduced roles such as the Designated Safeguarding Partner, the DSP, which involves operational police leaders being tasked with facilitating cross-agency information sharing and actions on critical child safety issues. It gives that dedicated point of contact and dedicated responsibility. In our case, it's the ACC, Catherine Clark. Additionally, independent scrutiny of these arrangements has been strengthened by ensuring that the police are actually held accountable for their contributions to child protection, which didn't really exist before. Overall, the 2023 framework has driven a more structured and transparent system for police involvement with child safeguarding, increasing the focus on proactive data and a child-centred approach across all the sectors. It requires police and children's services to work in tandem for the child's welfare, along with health colleagues. So what does this mean in practice? If we can just skip forward, Kat. So protecting vulnerable people is an integral part of North Yorkshire Police's mission and values, and it is a core element of our plan on a page. We need to embed the 6 principles from working together for 2023. And we've got focus on the voice of the child in our public protection notifications. This is our referrals that we use to share information with partners. So we've updated our public protection notification process, focusing on the voice of the child. providing training to all frontline staff on PPN submissions, and using the Aware mnemonic to make sure that we are capturing the voice of the child. Parents and carers are informed when a PPN is being submitted and why, so we've got that wider family engagement and improved interactions with parents and carers. PPNs are now being monitored through the vulnerability assessment team for quality assurance, and we're also identified any missed opportunities for safeguarding. We feed these back to individual officers and command areas to make sure that our standards are maintained across the force. Force control room have had specific training in the form of power hours, so that vulnerability is being flagged at the first point of call and the first point of contact with police. The missing and exploited teams, safeguarding investigation teams and criminal investigation teams are working closely with children's social care and forging strong relationships while monitoring incidents to ensure early prevention and intervention opportunities are identified. Joint training is to be trialled in York in February 2025 to further cement the relationships, knowledge and understanding of each other's roles, and depending on the success and feedback to this, it will then be rolled out across North Yorkshire. Skip forward, Kat. In response to Working Together 2023, we've reviewed all of our policies and procedures, and they've all been updated in the last 12 months. And it's always under constant review. The child death policy is under review currently, and we're represented at the CDOT panel by the Force SPOC. The joint protocol for missing children has been reviewed recently by North Yorkshire Police, North Yorkshire Children's Safeguarding Children's Partnership, and the City of York's Safeguarding Children's Partnership. The child exploitation procedure is regularly reviewed and updated, and this is mostly an internal policy, but it does take into consideration the principles of Working Together 2023. Our missing persons policy has been reviewed and updated, and our engagement with Learning Development Department and assurance has been provided for all the relevant material across North Yorkshire Police reflects the updates to make sure that everybody from a new recruit to a transferee to existing officers is aware of the changes. Our information sharing agreements have been updated via the DSL signature in the partnership. The creation of the lead safeguarding partner. We've got some good governance, including funding and data strategy from Chief Constable Tim Forber. Like I said earlier, the creation of the designated safeguarding partner role. So someone of sufficient seniority in the organisation is able now to deliver on place-based activity, and in our case it's Assistant Chief Constable Catherine Clark, and when she's not available it's Detective Chief Superintendent Ian Scott would be in attendance at the executive. Considering the working practices with prison and probation services, the processes are in place to share information with probation and emergency cases through the force control room. Further information is shared through the vulnerability assessment team. We have an ongoing project with probation regarding pre-sentence reports, where probation have access to police systems to be able to gather information prior to court cases. And we generate reports regularly for probation around domestic abuse cases, making sure that we're identifying ongoing risk, new potential victims, and children at risk of harm. And obviously, like Sam's mentioned, we've got the probation service now represented in the MAST. And assurance regarding the Section 11, which police are actively involved with, is obviously going to be tested in 2025 when the next Section 11 takes place. And that's it from a police perspective.
Thank you very much, Emma. I'm going to hand over to Sarah, who's going to cover from a health perspective. Serena, I'm going to put the link in the chat for the missing protocol, so I'll pop that on in the next few minutes. Over to you, Sarah.
Hello, good afternoon, everyone. So, as I said earlier, my name's Sarah Stansma. I'm the designated nurse for safeguarding children working for Humber and North Yorkshire ICB, which I could see on the chat. That was a question. It's the Integrated Care Board, and I'll be talking a little bit more about that in my presentation. So, as you can see, I've put an umbrella on there, and that's just really to emphasise the that health covers such a wide range of professionals. It's not sort of one organisation. It covers lots of professionals from both the private and public sector, and it's how we capture all that and ensure that those changes are integrated in all of those organisations, those working together changes. So I'm going to start just by setting the scene a little bit and looking at the bigger picture. So next slide, please, Kat. Thank you. So I am going to talk a little bit about the integrated care board, because as you can see, and as we've talked about previously, working together outlines the roles and responsibilities and looking at joint and equal duty between the three safeguarding partners. So that's the local authority, the police, and the integrated care board. So the integrated care board is who I work for, and the health aspect of that trio within working together. And from a health perspective, local arrangements have to include health and care infrastructure such as ICBs, local maternity and neonatal systems, provider collaboratives, primary care, and specialist commissioned service arrangements. So if you just pop the next slide on, Kat. I really appreciate how complicated the health landscape is. It confuses the life out of me, and I work in it and have done for many, many, many years. So I just thought I'd put this map on to kind of demonstrate again and shine a little bit of light on what the ICB actually is. So it's the ICB are health commissioners, and as I've said, the statutory safeguarding partners. So ICBs replaced previous clinical commissioning groups, so CCGs. So there has been quite a significant change in health over the last few years. So CCGs were smaller. I believe there was 4, it was before my time, before I moved across to North Yorkshire, but I believe there was 4 CCGs within North Yorkshire. And we've now moved into an ICB arrangement, and that's a national picture. So for us, the ICB is Humber and North Yorkshire ICB, and you can see on that map just how big that footprint is. So we're working across 6 places. We've got North Yorkshire, we've got York, Hull, East Riding of Yorkshire, North Links and North East Links. And I promise it took me a little while to get my head around that as well when I came over to North Yorkshire ICB in July of this year. So as I've said, we're the health commissioners, but if you just move on to the next slide a little bit. There we go, lovely. So we're the health commissioners and the that statutory partner. So we need to put our multi-agency arrangements in place and identify who that lead safeguarding partnership is within the ICB. So for us in health, it's the chief executive of the ICB, it's Stephen Eames. In terms of the delegated partner, so this is the person who will have delegated responsibility to attend things like executive meetings across North Yorkshire and be that representative. This is to be confirmed within the ICB. It's still a piece of work in progress. It should be confirmed very soon. The ICB are continuing to work through the arrangements for the delegated partner role to ensure that we meet the requirements of working together and ensure consistency at safeguarding meetings. But it has to be across each of our 6 places. So I think that's why this bit's taking a little bit longer, because whoever is identified will have to attend. If they're attending a meeting in North Yorkshire, they'll be attending the equivalent meeting in Hull. So it has to be the right person, but that should come out very soon. Next one, Kat. So, as I've touched upon, implementing the working together changes within health includes so many people. It includes so many organisations. I've just sort of thrown some in there for us really to think about who does this include, and you can read through them as I'm chatting. But the health landscape has changed considerably. I've qualified as a nurse millions of years ago, and the health landscape has really, really changed. So where things used to generally all sit under an acute trust and everything was an offshoot of that, that's really changed over the last few years. So we have services commissioned differently. So 0 to 19 services can be commissioned by a local authority in some areas. I know that not the HDFT team commission quite a wide footprint of 0 to 19 services. So it is difficult for other organisations to sort of understand what that might look like. And working in my previous job, trying to explain to a social worker that they needed to speak to a health visitor employed by HDFT when they're actually in Middlesbrough, you can absolutely understand how we do confuse the life out of people. But that's just sort of different commission arrangements that we need to explain, and sort of we have that responsibility within health to make sure people understand that. There's a lot of private providers as well, and obviously the requirements apply to them as well. Every health organisation needs to meet the requirements of working together. Let's have a look. Where are we up to? So, in order to do this, we have a health professionals network meeting, and this has been a standing point on our agenda over the last year to sort of support our health providers and our private providers to meet the requirements of working together and ensure that their policies and procedures reflect that. And we've worked together as a group, to do that over the last year. Next slide, please, Kat. So because there isn't a huge health specific lot of changes within this document, I thought I'd just spend a couple of minutes talking about shared responsibility, and I thought I'd do that by giving some health led examples from practice over the last year, because the responsibility just doesn't just sit with one organisation. As we said, it doesn't just sit with the Safeguarding Partnership. It's important that we all take a lead role in these things. So I just thought I'd share that and talk through a couple of those examples. So next one, Kat, please. So I thought I'd just talk very briefly about the thematic safeguarding review that was authored by the designated nurse, my predecessors, for safeguarding children, and it was published this year, and it was chaired on behalf of the North Yorkshire Partnership, and it was a thematic review following a number of cases, 3 cases consecutively, that involved non-mobile babies with significant injuries. So that it was felt there'd be learning out of there, and that's absolutely right. It was 3 infants that were only open to universal services, so they weren't open to social care. They didn't have extensive police record. They didn't have all of that multi-agency things, but every child is a universal child for health. So it was felt that it would be best for health to lead on this thematic review, which they did. Karen and Elaine, the previous designated nurses, did that. Obviously, strategic leads from the police and social care were key members of this review panel. And the summary of this thematic review, if anybody did want to read it, is just there on the partnership website. But there was a number of key pieces of work that came out of this that, again, were sort of led by health colleagues. So if you just go on the next one, Kat. So the Ask Me campaign, some of you, I'm sure lots of you have probably heard this. And this is what came out of the review, and it was about, are we asking the right questions? And by are we asking the right questions is, are we all asking the right questions? Are we all spending time having conversations with families, particularly when there's vulnerability within that family, when there's newborn babies, making sure that we're getting public health messages out there, but we're all singing from the same hymn sheet. So if we're talking to a family about safe sleeping or icon messages, so understanding normal crying patterns, it's important that we're all sort of singing from the same hymn sheet. And it might be that the health person isn't the person seeing that family as often. It might be that there's a support worker going in there quite frequently. So it's important that we all work together when we're delivering these partnership messages. Next slide, Kat. And again, from the thematic review, there was this Day and Night Sleep Right campaign was developed, and this is quite unique to North Yorkshire. And again, it's about that shared messaging. In some of these cases, there was concerns around co-sleeping. There was concerns about unsafe sleeping arrangements. Are we all sending the same message? This is traditionally a health message that would be sent out. It'd be something that health visitors discuss. However, we all have that responsibility to send the right message, and somebody might have a really, really good relationship with a family that isn't necessarily that health person. So I thought this was a really good campaign to sort of get that message out there. Again, this is on the Safeguarding Partnership website if anybody needed to look at it. But really valuable pieces of work, again, responding to themes that we're seeing, locally in North Yorkshire. Next slide, Kat. And I just wanted to talk very briefly on engaging fathers. The Working Together document talks about a child-centred approach with a whole family focus, something we try and do in health, and across the board. Different partners as well find this quite challenging is engaging fathers within all of the work we do. We're really good at engaging mums. We're really good at doing that within health. We know exactly who mum is. Do we always know who dad is? Does it have that same emphasis? Unfortunately not. We know from both local and national reviews that sometimes dads are unseen, male carers are unseen. It's not necessarily dad, it might be mum's boyfriend, it might be somebody else, but we're not actually asking the question, who's this? And that's something that we really need to improve upon. It's something that we're working towards. It's something nationally there's work ongoing around this. But locally in North Yorkshire, a colleague has just carried out a maternity audit. She's going to share the findings at our next safeguarding health network. And she's done a live audit of 5 deliveries a week sort of thing to say, did we capture the full name of fathers, the person with that mum at delivery? And the anecdotal findings are we don't. We'll say it's dad, it's father of the unborn. We write those things down, but we don't actually capture that full name. That's really, really important. We need to know who people are. They're important in this child's life. So we need to sort of have that whole family focus. It's really, really important. And just my final slide there, moving on, Kat. Again, on that same theme, a whole family focus. In health, particularly sort of in an acute trust, this was a piece of work that South Tees did, covering the Friarage Hospital, in response to learning from safeguarding practice reviews, again, locally and nationally. Are we asking that question? You'd be surprised. You know, it should be absolutely routinely asked every single time. Who's this? Who have you got with you? What relationship are you to this child? Unfortunately, we're not doing that with absolute consistency. So this was a campaign that was that's been shared around that acute trust, and it's giving professionals permission to ask that question, and it's letting families know this isn't just you. We're not just asking you. We ask this of everybody. So anybody attending a service with a child or an expectant mother will be asked to give their full name. This is perfectly normal. So it's about capturing that whole family focus. And that's it from me.
Thank you very much, Sarah. As you've been talking, I know you've mentioned a few key documents and campaigns, so I have popped them in the chat so people can kind of access them. Apologies if things have kind of been peppering up in the chat for people as you've been talking. I hope it wasn't too much of a distraction. So we've had presentations from our 3 statutory partners. Health, I was doing the umbrella term, which Sarah's talked about, North Yorkshire Police and our local authority, Children and Family Service. But as a partnership, we wanted this session to kind of show how much we valued and how much we saw our relevant agencies of education and our voluntary sector as very much equal partners in our safeguarding arrangements. So I will, with that note, hand over to Julie, who's going to give us an update from an education point of view. Thank you, Julie.
Thanks, Kat. That's a really good description as well of where we are with education at the minute. So I'm Julie Bunn, Head of Alternative Provision, and sitting at the moment for the next few months till August in inclusion. But I'm also the virtual school head, and I know Amy from my team is in here today. So 2 hats, I suppose, today. So virtual school are responsible for all the education outcomes of all children in care, all children open now or have ever been open to a social worker, and previously in care, so adopted an SGO, and more recently providing advice and information to kinship families as well. But today I'm really here to talk about the work that we're doing around the working together, and to tell you a little bit about the future education subgroup and how education as a relevant agency is going to be hugely involved in the safeguarding partnership. Next slide, please, Kat. So the key changes in working together were that it's recognised that education settings have a pivotal role to play in safeguarding children and promoting the welfare. We are the eyes on the child, aren't we? We're the ones who are at the school gates as well and know all the networks and who's picking the kids up and notice changes in children. And our insight and cooperation is vital to multi-agency safeguarding arrangements. And really, we need to now make sure that the views and contributions of education and childcare providers are articulated at the highest level of decision making. But to be honest, in the consultation that we did about just over a year ago, schools admitted that they felt forgotten. They felt left out of the multi-agency loop and not really heard, as it were. Next slide, please. So what have we done around that? Well, nationally, I'm part of the DFE Working Party on Working Together. So I was part of the rewrite group. So I really hope if we've got education settings here today, which I think we have, that you see yourself more in that document, because I don't think it really read towards education professionals. So I did help with that. And I'm also working with the DFE now around education subgroup plans. So I've been working with someone called John Lefebvre, who is working with local authorities on exactly that. How can education be part of the safeguarding partnership, but as a relevant agency? I'm no longer hearing the phrase, can education be the fourth safeguarding partner? Actually, it's much more around what would a role look like to make, or a couple of roles within the partnership, to make sure that all ages, stages, types of education can give their information in, but also receive information from. So how can they be present across that safeguarding partnership? What would it need financially and legally? Next slide, please. So what we did do initially was to talk to a group of head teachers and ask their views about being the fourth safeguarding partner. And I think because of that role, it kind of got a bit of traction, and we now have a very representative group of head teachers across all ages and stages. So we're moving that towards what would we need to do to be that representation, to be that subgroup of the safeguarding partnership. And again, in the new document around certain changes for kinship from virtual school, the statutory role that we're going to have now for child in need and child protection, and also some of the checks and balance checks that need to be made on children with elective home education. They're all things that I'm really pleased to see and are part of this agenda. Next slide, please. So at a recent meeting with the DFE, things that we're going to expect that the DFE are working on are those practice guides for kinship care, the overall framework, the consultation of use on agency staff, the Children's Wellbeing Bill, a not in school register and the Ofsted Big Listen, and regulation of profiteering our children's homes and multi-agency child protection teams, and strengthening the education in multi-agency safeguarding arrangements. We're also expecting work very soon on a single unique identifier for children, and a children and young people version of working together. And I know that I'm really excited about that, because I do think that that kind of easy to read version will be something that is used very much in schools as well. Thanks, Kat. Next slide, please. And we've heard from the Secretary of State very many education aspects to the latest document, Keeping Children Safe, Helping Families Thrive, and Sam was talking about that. And as I mentioned, the main priorities there were the fact that kinship care and the role for virtual school is going to be made statutory, so that any child who's ever had a social worker will come under that virtual school umbrella, and that the EHE checks will be strengthened around open to Section 47 and child protection. Next slide, please. So we do remind the group that that if education did become a statutory partner, there would be huge governance and accountability that comes with this, and being part of the partnership around conducting serious case reviews and how education would be part of that. I think that's further down the line now, and I think, as I said, John Lefebvre and the DFE group are looking to certain local authorities to trial things like an education voice being there at the screening at the front door, and also what would that education role as a safeguarding subgroup look like? How would we make sure we get all the voices of all the different parts of education? We are interested to follow up a little bit of research that's going on in London around that and around education at the front door, and we'll be bringing that back to the group. Next slide, please. And then I just wanted to remind the room that actually there's the working together to improve school attendance as well, and that's obviously very directly aimed at schools, but a lot of the methods, that systemic view, multi-agency meetings, making sure that we know the wider aspects. There's never a single reason, and we don't want to ever look through a single lens. We need to look very systemically at any education issues, including attendance. So I thought I'd finish with that. Nicole, I'll double check because we've got quite a big group working on that young people's guide, and I'll check if the Youth Commission are part of that. Is that me, Kat?
Hang on, that is you, Julie. Thank you very much. I'm going to hand over, last but not least, to David.
Thanks, Kat, and thank you everybody for staying on. My name's David Sharp. I'm the Chief Executive of North Yorkshire Youth. I'm also the Voluntary Sector Rep on the Executive Safeguarding Partnership Board, and I chair a VCS working group, Task and Finish group. It's got Community First Yorkshire, North Yorkshire Sport and St Michael's Hospice representatives there. So that's a really useful piece of work that we do to try and make sure that we've got the VCS involved in everything that's happening in the safeguarding world. And so just to say thanks very much to the colleagues who've been involved in all of this from those organisations. Just wanted to give a bit of a contextualised view of where the voluntary sector sits. You've heard a lot about us, and that we need to be part of this, and we are a partner within it. Even if we're not a statutory one, we are very much integrated within it. But actually, what's the definition of a VCS organisation? And it's on the screen for you there. And as you can see, it's a very, very broad range of organisations and community groups, ranging from really local, small people, 2 or 3 people together, up to national organisations doing things. Have the next one for us, please, Kat. Thanks very much. So some of the characteristics of the voluntary sector: non-profit orientation. So no one's trying to put a Ferrari in the car park. Although if someone wants to donate one to me, I will then create a lottery and sell it on and create some funds for the voluntary sector. We have lots of voluntary participation, so lots of volunteers doing work. That's from board members through to people who are actually doing delivery work. So really integrated within the organisation is the volunteers, who do an amazing amount of work for us. We're very mission driven, so we've got objectives and aims that are all about social progression for people and improving the lives of our communities that we live with. And that can be very thematic, and it can be very broad ranging as well. So it does become incredibly useful from a perspective of the partnership that we cover a very broad range of individuals. It's independently governed. So we've got boards of trustees, as I said. They're the people who are making the decisions and helping us strategically to make sure that we're in the right places. And we've also got that public benefit element as well. So again, that's about the fact that we're not trying to put a Ferrari in the garage. Can I have the next one, please? Yeah. So in terms of our size, we're huge in North Yorkshire. I got these figures the other day. We have over 15,000 paid staff working in the voluntary sector in North Yorkshire. Education's only got 19,000. Agriculture, fisheries and farming has only got 7,500. Construction's only got 12, and finance has got 6. So as you can see where we sit, we're a really significant partner within the county in the terms of the workforce that we've got. We've got over 7,000 different groups that are actually constituted. I think there's an awful lot more, probably double that, of just small groups who are doing things, who want to just help their own communities. And as you can see, 67,000 plus volunteers across the county. That's a massive workforce. And it gives us a real huge opportunity to have a massive impact upon what we're trying to achieve, because it gives us those opportunities to see things, which I think that other agencies might not get to do. Obviously, the importance of the sector is we've got a very huge social impact. When we've got a workforce of that size, then it brings an awful lot of opportunities together to actually help our own communities. Community building, I'm not talking about bricks and mortar stuff. I'm talking about that community cohesion element of what we can do. So when you've got a small group that's operating in a village hall, actually that creates this sense of community that then brings more people into it. It creates that situation where, as Sam said right at the very beginning, it takes a village to raise a child, and that's exactly what the voluntary sector does. We innovate, we always have to do that. We're always looking for trying how we can fund ourselves. And one of the things that funders do is say, what are you going to do that's new and different? So innovation is part of what we do and is a huge ethos of what we are. And then advocacy and voice is also a significant part of what we do. So some of the work that I'm doing is about that. But then we get lots of other groups and opportunities for people to give in their views. And we like to make sure that we do that as best as we can. Okay, so it gives you a bit of a context around what we do as a sector. In terms of our working together implications, we aren't a statutory partner, but we are very, very integrated, and we feel that it's really important that we follow the principles that are behind working together, and we continue to do that. So the 4 principles within the first chapter are child-centred, working with parents and carers, multi-agency work and information sharing. So how we do that as a sector? Well, empowerment is one of the first things. So we have young people at the heart of everything that we do. We're planning sessions, youth boards, clear lines of communication to staff and volunteers on what the young people are needing and what they're wanting. And if you think about that impact, that innovation work that we do, empowerment in terms of what young people want, and then our innovation can actually provide a really powerful position for the young person to get what they actually require, not what we think they need. Again, advocacy and awareness, so we can become an independent voice, because there's not somebody suggesting, oh, actually, government says this. We can actually stand there and go, oh, well, we don't agree with the government, we don't agree with that policy, we don't agree with this policy, we'd like to try and do things in a different way. And we can also create that awareness for people, so it's a two-way communication. Capacity building, I think this is a real sector opportunity. So through the different types of funding we've got available, we can actually put on things which are really bespoke and really unique, and quite quickly as well, whereas sometimes it takes statutory partners a bit longer to get some of those things in place just because of the size of those organisations. We can sometimes do that really, really quickly, particularly if we can find a funder who does something within 6 weeks. We can have something up and running within about 8. And then, of course, we've got our monitoring and evaluation. The size of the organisations and the size of the sector give us that real opportunity to get an awful lot of intelligence into the Safeguarding Board, as well as other agencies and other statutory partners, that we can then help to shape things for the future for ourselves. And I think it helps us to build community resilience. We've got huge amounts of resource sharing, networks and forums, and just the raft of things that the voluntary sector can do, which fit with this shared responsibility, are significant. So I've just covered a few bits and pieces there for you. In terms of chapter 2, how do we align with multi-agency safeguarding? Well, there are 2 main areas that the VCSE supports that. There are several county-wide infrastructure organisations providing advice, guidance to groups. So there's Community First Yorkshire, there's North Yorkshire Sport, there's Rural Arts, and there's ourselves as North Yorkshire Youth. So we do the thematic county-wide stuff. Then there are an awful lot of local organisations and CBSs, particularly the community organisations, that are helping their own local communities and their own local groups, volunteers, and that covers a vast amount of activity. And to support that and make sure safeguarding is front and centre of those groups, a self-assessment checklist has been created by Handles Community Action and Community First Yorkshire, and this provides a framework to the sector on what needs to be in place and what information is required. In addition to the checklist, we can get in touch with their local thematic infrastructure organisations to receive support and answer questions and queries. And in this way, we always look to improve and ensure that those working with vulnerable people have the skills and knowledge and expertise to deal with those they come across. And to support this further, North Yorkshire Council, along with the VCSE group that I chair, produce some awareness resource to promote the safeguarding processes, intelligence gathering, and general safeguarding messages. And actually, that's that lot there. So hopefully you've seen some of these. I have seen them in a few venues and they look amazing. Please keep sharing them. It's really important that we get this message out there. So it was aimed at making sure that we could improve communication with the VCS, but not just as a one-way process. What we wanted was the VCS to be pushing back into the Safeguarding Board as well as the other way around. So we did some consultation work, and we found that a lot of it, for the voluntary sector, it was a bit too complicated. Who knows to know what they need to know? how much information is required, who within an organisation needs to have that level of knowledge that then can provide the access to doing something that's around managing an allegation against a member of staff, for example. So we agreed that we would focus on just the key messages so that then they can find that support. So it's not necessarily about holding knowledge in the voluntary sector, it's about where they look for it once they've done that. And then we talk to partners who are the experts in some of these things. So you have some voluntary organisations with only 2 members of staff, and they don't have the time to then do all of the training that's required that would take them to a really high level in terms of safeguarding. One of the things I'm really pleased about is that we've managed to get in the basic safeguard awareness training for free for voluntary sector partners. So if you want to access that, get in touch with your local CVS, CAO or thematic support organisation, and we'll point in the direction to get that done. We love the QR codes as well. They're great. They just take you straight to the place where you need to be. So again, a really useful resource. And I'll say it again, please share that as widely as you can, and please make sure that they get out there. Okay, next one, please, Kat. So in terms of chapter 3, providing help, support and protection. In very many ways, we've got our own processes that we need to do on this. So the Charity Commission give us our own requirements. So that's identifying and managing risk, having suitable policies, checklists, protecting volunteers and staff, and then reporting incidents. And we do that through our own policies and procedures and the checks that the Charity Commission require us to do. So all of those things are already in place. But it's not just about those things there and about covering your back and making sure you've got all those bits in place. So we do actually share good news stories as well and good practice. And I think one of the things that's really good from the voluntary sector is our generous leadership, because a lot of the people who are in the voluntary sector don't get paid for what they do. So they're actually providing that leadership within communities because they want to do so and they want to make a difference. And I think that makes a massive difference to the opportunities that are available within our communities. And then, of course, we use the early help system, the VCS process of referring for our exit strategies. So if we're really struggling with somebody, we then need to escalate it. We have that opportunity. So we sort of sit as a voluntary sector mostly underneath where early help would be and other statutory services. Okay, next one. Thank you. So how does it align with organisational responsibility? Again, chapter is closely related to the previous ones, especially the internal requirements of the organisation. And again, the sector is well supported in this. So leading on from the previous stuff, we need to ensure that organisations have robust, up-to-date and practical policies that staff understand, provide relevant training. Free is always the best word that I'm looking for. So if you've got free training, please keep that on the newsletters and get that out there. We'll get as many people on as we can. But obviously, we can get funding for training, so we will endeavour to do that as well. We ensure governance arrangements are robust. So, for example, every Board of Trustee meeting should have 3 standard items on it: safeguarding, health and safety, and a risk register. Every board should have that as a standard item. Personally, I always want to say no to all 3 of those whenever I get asked at my board meetings. So that's always my aim. And then we also have the eyes and ears in the community, so we can do that intelligence gathering. It's got a real insight on what's going on in the communities and sees things other agencies might never be able to see. So we don't wear uniforms generally as a voluntary sector, not in the same way that a school teacher will, or a police officer or an NHS member of staff will. So it's a very, very different relationship that can be created with the voluntary sector. So we see things very, very differently. And through that, we have a little bit more power to potentially help intervene, because when we see something, we then say it, which then gets the support that's required. And that gives us that unique insight into the relationships and issues within a community. Last one for me, I think. Thanks, Kat. Thanks so much. In terms of chapters 5 and 6, that's been covered a little bit by Sam. In terms of the voluntary sector, we don't really have a remit within this. However, we can support the process. And one of the things that has changed is that now part of the questions that are asked when these reviews take place is there any interaction with the voluntary sector? And at which point there, that organisation is then invited into the reviews to make sure that they've got a full picture of what's been going on with that individual. And I think that's a really important element that we as a VCS need to embrace and make sure that we're part of that, but also that the question is getting asked in the first place. So although not specifically linked to us as a voluntary sector, we still have a role to play within it. So thank you very much for that. I think that's my last one, Kat, so I'll move back to you.
That's it, David. Thank you so much. I have pop the link for the VCSE campaign into the chat. I would just echo what David said. It is a really useful campaign, and not just for our voluntary sector partners. So these are kind of posters and leaflets that you can have for your your staff toilets, and supporting kind of reception staff and people that are kind of encountering families and young people but may not have that necessary kind of safeguarding skill. So it can just give them some of that basic information of where to turn and who to talk to. But yeah, that's in the link for you to access. Thank you very much to our presenters. Hopefully that's given you a little bit of an insight into basically the breadth and scale of safeguarding right across North Yorkshire and what it means to all our wider partners. For me, it's always insightful to kind of see what it looks like from different lenses. So what it means from North Yorkshire Police perspective, what it means from a voluntary sector perspective example. But it's kind of showing that we're trying to embed it across the whole field, really. So just a couple of final slides from me, just in relation to our multi-agency safeguarding arrangements. And then I've given us lots of time, as I've said. I'll invite our panel speakers to pop their cameras on in a couple of minutes. And we do have an open forum if anyone's got any questions. So be thinking as I'm going through these last couple of slides. So to kind of wrap it all up, really, I want to go back to our multi-agency safeguarding arrangement document. So this will be our key document. This is our key document. We do have one in place already, and it sets out how the safeguarding partners in North Yorkshire coordinate safeguarding services, and explains how we all work together to fulfil all our legislative duties, which is basically what we've been talking about for the whole session today, really. As I've mentioned earlier, it sets out and clarifies the roles of our lead safeguarding partners, who are our Chief Executive for North Yorkshire Council, our Chief Executive for Humber and North Yorkshire Integrated Care Board, and our Chief Constable for North Yorkshire Police. So these names have been mentioned throughout the presentations today. The document also shares our delegated safeguarding partners, which is our Director of Children and Families for North Yorkshire Council, our Assistant Chief Constable for North Yorkshire Police, and our place nurse director. Like I said, Sarah is waiting. That's a role to be confirmed from health. The document clarifies the role of our independent scrutineer, who also acts as our executive chair. And that role of scrutiny is really to kind of provide safeguarding partners and relevant agencies with that rigorous, effective support and challenge at both strategic and operational levels. The role supports the partnership drive for continuous improvement and insurance, and it gives us that assurance that arrangements work effectively for children and families and practitioners, and add values to the work of the partnership, essentially acting as like a partnership critical friend, really. So the new MASA document, as a partnership, we have to have that ready before Christmas. So we're making you hang fire a little bit longer, and we will have it ready for you before Christmas as our Christmas gift to you, for you to take back and share with your teams. This is just a screen grab of the one we have currently, but our new structure will be available in the next couple of weeks, which we will circulate. And as I've said, the multi-agency safeguarding arrangements capture how we listen to and act upon the voices of children, young people and parents and carers. That's a really integral part of our new document. We've spent a lot of time speaking to young people and parents and carers and they tell us what they wanted in these arrangements as well. This is a bit of a complicated diagram that I've put on this slide, which you can have a look at when the document's released, but it effectively shows our subgroup structure, kind of how we do all fit together in terms of meetings and governance and assurance. And you can see on there, we have that new addition of our education subgroup as well. So that's a very welcome addition to our kind of set subgroup structure, which Julie's been talking about. So what next? So as I've said, that our new multi-agency safeguarding arrangement is due for release in the next couple of weeks, certainly before Christmas. We are very much aware that we may get a new iteration of working together that may be released by the government fairly soon. But as I've said, we won't be expecting any significant changes that wouldn't warrant a change to our MASA document this year. It may be that there's some minor changes, but we will make sure we share a summary of those when they do come through. what I don't want you to go away and think of when we've come to the end of this session and you get the multi-agency safeguarding arrangement is that that's our end goal. The production of a document, the kind of accumulation of a year's worth of work of looking at working together. What I'd rather us to kind of come away and look at this is kind of basically a next step on a never-ending safeguarding journey. There will always be lessons for us to learn. There will always be reviews of documents to look at how we can continue to work together to give the best outcomes for families and young people. So really, it's kind of a consideration of how you can use these documents and these discussions in your own practice, what you can take back to your teams, and the discussions that you can have. We really do want you to go back and kind of have some discussions with your teams about this, and think about what working together means to you. You out there doing the do, speaking to families and young people, being members of communities every day. What does it mean? Are there any gaps? Are there any things that you need additional guidance or knowledge? If you're identifying any, I would ask you to go and look on our website and look at those bits of practice guidance and see if that fills those gaps for you. And if it doesn't, get in touch with us. Let us know if you're feeling like actually we need some additional guidance with this. We can look at what we can put together to support that with you. Be aware as teams of how you can keep up to date with those changes. That's our role as a partnership business unit, to give you that kind of opportunity to access those changes and any updates that we make as quickly and as easily as possible. So we do make changes to the website. We will put things on our e-bulletin. So speak to your teams about, do you have those links? Are you all signed up to e-bulletins and things like that? And do you know how to get access to those key documents? So we've touched on kind of the reviews of particular bits of practice guidance, things like information sharing and professional curiosity. Do you know where they are? Can you access them on our website? And take that little bit of time to have a look at them and think, actually, what does this mean? Does it change anything that I'm doing with the work that I am doing with children and families and young people? That is our final slide. Before we invite our panels to take any questions, I just want to take a couple of minutes to say a huge thank you to the people who have given their time to put some slides together and come and present. It's not the easiest, and most, some people it's quite daunting to come and speak in front of a virtual screen. So thank you so much. And like I say, please take this opportunity. It's not very often you get this chance to kind of speak with our wider partners and ask questions, learn about different services that you may not have that knowledge and experience of. So over to you guys if you have any questions. Hannah, you've got your hand up. I'll stop presenting.
Thank you, Kat. I just wanted to echo your thanks to partners for coming together to deliver this, and I just also wanted to say a really big thank you to you as well. It's been a lot of hard work that you've put into this over the last year, and it's great that it's all come together really well, so thank you to you too.
Thanks, Hannah. Right, so if I can ask presenters, Julie, if you want to pop your camera on, I think that's everybody, isn't it? If we do have any questions, please feel free to pop your hand up or pop them into the chat. Going through the chat, I think the only one that we had was in relation to quite an interesting question. It was based on one of the slides that you were talking about, Sam, in terms of effective kind of supervision around safeguarding, and someone asked a question about how that fits from an education point of view. So I didn't know, Julie, if you wanted to jump in on that one, or Sam. You're on mute, Julie. Let me see if I can find it.
I think the question was, what does supervision look like for staff in schools?
That was it, yeah, thank you.
Well, the basic answer is I don't think we have.
Oh, Julie, your sound's gone. If you just want to plug try your thing again.
There we go. I just had my mic on my head. Well, the basic answer is no, we don't have any form of quality supervision in schools at the moment, but it's something that we are recognising as a need. And I know that some schools, are beginning to buy in some clinical supervision, and the EPs are certainly interested in that. But we definitely don't have you know, that regular supervision when you've de-escalated a supervision, your cortisol's raising, you're not regulated yourself, really, that's where it's missing in schools. And I think we've got a lot to learn in schools from that social care model, and probably the health model as well, because there just isn't a form of supervision for teachers and education staff. So they probably go home absolutely on the ceiling and don't at some point get that time to reflect. I mean, again, I always say what I've learned as a teacher in the last 8 years in social care, the mapping is fabulous, the formulation, the curious questions, the slow thinking, the systemic thinking, you know, and we need to ooze that into education. I mean, it's beginning, but I'm not going to say anything really that it's anywhere looking like what it should look like. But I think it's going to need real change from leadership, the recognition that is a need, and then that kind of philosophy that you need that reflection and psychology as part of your staff well-being. It's probably not the answer you wanted. I'll have to work for another 10 years with Sam to get that one working, I think.
Thank you, Julie. No other questions in the chat. I think there's a couple of comments. Amy's put in a link in relation to supervision for DSLs, which is really helpful. Thank you. Joe's put in something about getting supervision in school from the trust safeguarding lead, which is really interesting. So it's useful to understand, and it's maybe something we can take to the education group as well. Julie is getting an understanding of what that looks like.
It is on the list, definitely, and there are a few people. Kate from the Tadcaster area are definitely working on it, and a couple of schools in Harrogate as well. So, sorry, Michelle, but we know it's a need. We definitely know it's a need.
Thank you. Any other questions from the group? You've got the panel here ready and willing. If anyone's got any questions, please put your hand up. Sue, over to you.
Hello, sorry, I was just struggling with the technology there. Just one that we've experienced a couple of times where we've asked for safeguarding information from other agencies or other schools, and we've been fed, we've not been fed the full picture. Is there a way, not that we want to get anybody into trouble, but how do we deal with if we find that there's agencies or schools that are not working together and transparently as we all would probably hope for?
Well, I would say you would follow that usual route of then going to the manager and discussing it. And we do have, as we say, that working together group. So it's something that we could, you know, bring to that group. I mean, I'd probably need to hear a little bit more about the case and whether that person was keeping things from you, or whether they simply didn't know, or was it a breakdown in admin, you know, things like that. So we'd probably need to know a little bit more about that, Sue. I've got a feeling that it might have been your feeling that they didn't tell you as much, and you kind of found out once you met the child.
Yes, that was exactly the case.
Yeah, maybe we'll have a chat outside of this, Sue, and we could bring that up as a case study when we're looking at practice.
Great, thanks, Julie.
Thanks, Julie. Hannah, have you got something to come in with on that one?
Yeah, I was just going to say it's less case specific, but just to draw people's attention to our managing different professional perspectives practice guidance as well, that gives you a sort of staged process if you're if as practitioners, professionals, you're kind of struggling to come to an agreement about certain things. So it's just worth us highlighting that guidance too.
Thank you.
I will always say speak to people though, Sue. And if you're, you know, receiving a new child, I say go back to the school who knew that child best. If social care are involved, speak to them, because you're always better having that conversation around a child than relying on what's shared by paper. And some children read very differently, you know, and you'll hear different things, don't you, than what it says on paper.
Yeah, we did, and we've reached out to different agencies than we asked for original clearance, and unfortunately they've not come back to us. So
okay.
Seems to have come to a block
but
on that.
Yeah, let me know a little bit more about it, Sue, and we'll, as I say, we'll raise that.
Thank you.
Thanks for that, Sue. Any other questions from our panel? We might have shocked everyone into silence. I am always aware that some people aren't keen on asking questions when there's a recording. So if there aren't any more, we will stop the recording and stick around for an extra couple of minutes, if that's all right, panel, just before we go. Final thank yous, and I just want to take this opportunity to just remind, we've had a lot of frontline practitioners in the meeting today. As a business unit and as a partnership, we are kind of working on a frontline practitioner forum. So this is an opportunity to kind of hear from frontline practitioners at a much more regular opportunity to develop some of our strategies, some of our ongoing work. You know, we know that you guys have such amazing experience and insight, and we want to kind of capture that really. Our next one is the 15th of January. It's just an hour over our lunch break, so we keep it really informal. But if you are interested in coming, please just pop me a thumbs up or a yes in the chat and I can send you the Teams link. But other than that, we've finished well before 2. We've given you an extra 20 minutes to enjoy a cup of tea and go get some lunch. Thank you so much for attending. Like I said, panel members will stick around and we'll stop the recording if there are any questions at the end. Hopefully